Hi, Dr. Meeks. Nice to meet you. My name's Veronica Velez. I go by Veronica. I am a certified registered nurse in the operating room here in Houston, Texas. I work at Texas Children's Hospital in the Texas Medical Center. I've been a nurse for 20 years now in various different realms. I've done everything from emergency room to med surg, but most of my focus time has been in the operating room. I've worked in various different positions from a staff nurse to different management roles, which I'm in now. I'm currently an orthopedic surgery operating room coordinator, so that means I take care of anything and everything related to orthopedic surgeries, from scheduling it, assuring that there's enough time on the surgery schedule for the procedure, communicating with vendors for various different implants and supplies needed for specific cases, talking with the doctors about details regarding the cases, communicating with staff regarding details that they need to know to perform the procedures on patients. Anything that you can think of that has to do with orthopedic surgery, I'm probably somehow helping to arrange for it. I first started nursing when I obtained my licensed vocational degree in nursing. That was in 1998. I got that from San Jacinto College. It was kind of my first stepping stone into nursing. I have since obtained my ADN degree in nursing as well from San Jacinto College. And then here recently, there's been a push for magnet programs in hospitals, and being magnet accredited is a big deal, and part of that is assuring that you have a high percentage of baccalaureate nurses in your staffing. So they've had a hard push for obtaining your BSN, and some hospitals are no longer hiring nurses unless they have a BSN, so I had a lot of pressure to obtain mine. So I got that in 96 from the University of Phoenix online. And now I'm here at LSUS working towards a master's degree, and I'm doing it for myself this time. Every other degree I've gotten for one reason or another, almost being forced into it. My first degree I kind of did because it was the fastest degree, or it was a license, my LVN license, and I obtained that because I was able to find funding that paid for 100% of the program, including daycare and textbooks. If I needed a pen, they paid for it. They paid for my lunches. Anything I needed to be successful in the program, they provided. And I was a teenage mom, so that was amazing that they did that. And it was amazing that I was able to become a nurse in a year. And it helped me financially. It helped me steer away from being in any type of government assistance. So I was really grateful for that. And then I just decided to continue expanding my nursing career because it assured me more money and more stability. So my MBA degree, when I obtain it, is something that I've wanted. I've wanted to be in business. I may not leave the nursing profession completely, but maybe work in a more business aspect of healthcare. And I think I'll find that more interesting. I think it'll be more suited towards my personality, and it might be a little bit more fulfilling for me. So I'm hopeful that I'll be able to change my career path a little bit for the positive and for something that I want to do and pursue. So I think this class in particular will be interesting, will help me a lot. I have talked on several occasions with my family, and we're interested in buying, starting with one, but maybe ending up with a few different franchises and kind of running them collaboratively as a family, and I think that would be a lot of fun. So definitely what I learned in this class and what I learned obtaining the rest of this degree, I think will be very beneficial if that comes to fruition for me and my family. other than that, I became a grandma recently, so my grandson is the center of my universe. I jokingly tell people that with my busy schedule between school and work, he's the only extracurricular activity I partake in, so he's my hobby. But in addition to that, I do like cooking. I've recently tried to be better about doing some clean eating and eating less meat and focusing more on fruits and vegetables and things of that nature. And I love to travel. Again, my schedule doesn't allow me to do it as often as I would like to, but when I do get the chance, I do travel, and I try to leave this country and go to somewhere else and kind of explore. My favorite place that I've been to date is Spain. I feel centered there and rooted because I do have a lot of inheritance that comes from there. So that's just a little bit about myself. It's really nice to meet you, and I'm looking forward to the rest of the semester. Bye.